I'm Stanley Baum, and my career in radiology really started as an interventional radiologist. I did that for many years and then kind of migrated into chairmanship of radiology at the University of Pennsylvania, and I did that for well over 20 years. And now I'm an editor of a journal, Academic Radiology. It's difficult to separate RSNA as an organization and the RSNA annual meeting. I think it's proper to say that the RSNA and its meeting are clearly the premier imaging society and meeting in the world. And all you have to do is just walk the hallways here. And what has happened with the RSNA and its meeting is that it's become the international meeting of imaging scientists and educators. So the RSNA is the pinnacle of, in my view, of imaging organizations. Without the RSNA being there, we would have probably become a group of individual silos. One place doing imaging research, another place doing teaching of radiology, the other silo perhaps being the clinical impact of radiology. And then we'd have to go somewhere else to take a look at the major technological advancements in equipment, et cetera. And the RSNA has put it all together. And it does all of these in an outstanding way. The first time I attended the RSNA meeting back in 1963, 62 or 63, I presented my first papers here, getting up before a group of my peers and presenting my research, getting feedback from my colleagues, feedback not only from individuals in my part of the country, but throughout the country. It was a much smaller meeting at the time, and I guess the old folks remember when the RSNA was held in the Parma House, everything. The scientific sessions were held there, the refresher courses were held there, technical exhibits, educational exhibits, and then it began to grow. And as you walk the halls of the RSNA now, you clearly view it, it's an international meeting. And you interact now with individuals in all countries, all continents and all countries of the world that are doing imaging research. Well, I would tell residents who are first-time attendees of the RSNA to don't take it for granted, and that this organization runs exceedingly well, but it's run by volunteers. And if you want to continue to see this as the premier organization in the world, you're going to have to get involved as a volunteer and be part of the RSNA. They have a wonderful staff, but as you look at the board of directors of the RSNA, they rotate off. They're not permanent positions. And they got there by being volunteers in this organization. And there are wonderful opportunities for young people to be involved and stay connected. And it should not be something you take for granted. This will not continue unless the young people see a value to organize and volunteer. There are very few areas that have changed as much as interventional radiology. And I was one of the first interventional radiologists, and we wanted to get together with our peers, and I remember we identified 24 people who did interventional radiology. We had our first meeting, and about 24 people. Interventional radiology has become a discipline now that has, the Interventional Radiology Society has probably 6,000 people. Their annual meeting is over 10,000 individuals. And what the specialty has done is it's gone from an area where they would perhaps diagnose things like gastrointestinal bleeding to treatment. So not only were we able to go from the diagnosis of things like bleeding, we began to treat bleeding. And then we began not only diagnosing areas of narrowing in blood vessels, but we fixed it. We fixed it with balloons, then we fixed it with stents. We then migrated away from just being interventional radiologists for the vascular system and began doing interventional radiology in all areas of the body, in the liver, in the lung, in the spine. So it's almost a discipline in itself now. And as a matter of fact, there's going to be a new tract of interventional radiology where people will be trained in diagnostic imaging, but also in not only interventional radiology, but the various subspecialties that interact with interventional radiology. So it's been a quantum change over the past 40 years. It's hard to predict what this discipline will look like in 100 years. I suspect it will look as different as what it is today as compared to when Röntgen first made that image of his wife's hand. And we'll just have to see.